Welcome, everyone. My name is David Grady. I work for the State Council on Developmental Disability. I am the regional manager for the Central Coast, which includes the catchment areas of both San Andreas Regional Center and Tri-Counties Regional Center. Today, we are going to talk about crisis intervention for people with intellectual and developmental disabilities with co-occurring behavioral health needs. And I'm delighted to have with us today Aaron Kitzman, who has been active within our developmental service system. I worked at Via Esperanza. You were the director, right, Aaron?
I was one of the vice presidents, yeah.
Okay. And then now he works for the county, and he's very active as a program administrator too, involved with the Ventura County Law Enforcement Crisis Intervention Team. We're going to be talking about crisis intervention. We're going to have kind of a focus in on Ventura County, but I want to point out that what we talk about today parallels in all counties throughout the state. So what happens in Ventura County, there is likely to be a parallel program in another county, such as Santa Clara County or the other counties of Tri-County Regional Center. Erica, I see you speak Spanish. Erica, you're welcome to join. I do not have a Spanish interpretation for this meeting. However, we plan to do this series of trainings in Spanish, and we can invite you to those trainings when they happen. I have your email address, and I will email you when those trainings are available. Thank you, Erica.
Okay, thank you.
But you're welcome to stay now and join in the Spanish-speaking version when we have those in the future. Okay. I'm going to quickly start off sharing my screen. I might have to turn yours off real quickly.
Yeah, I'll stop sharing.
Yeah. And then I just want to. So quickly, the State Council on Developmental Disabilities is a unique organization. We are not related to the Regional Center or any other organization such as the Department of Developmental Services, but we are a separate state agency, and we are funded with federal dollars through the Intellectual and Developmental Disabilities Act. And our intention is to do whatever necessary within the developmental service system to improve the quality of care and the services provided to people and families with developmental disability. We have 12 regional offices and central and headquarters in Sacramento. We have a council of about 30 members, which is composed of half being family members and individuals with disabilities, and the other half being members or administrators from the governor's administration. It's a great way for the public to speak directly with our government administrators. The way we do our work is unique in that we offer advocacy assistance, training, which is what we're doing today. We monitor work, and then we offer public information and work directly with the public. Today, we're going to be talking about a sensitive topic, crisis intervention for our children or people with behavioral health disorders. It's hard. Families may have gone through some very unique experiences, but those experiences, although not uncommon, can be traumatic and triggering. So it's understandable that some family members here might be sensitive to the topic, and if so, we definitely want to offer our understanding and empathy and share the utmost most respect. If you need to, turn off your speakers, log out for a minute and come back in. But you're not obligated to share if you don't want to, and listen mostly and take a break if needed. So we're going to ask that from everybody here today. Okay, I'm going to turn it back to.
Yep, you want me to try to share my screen again?
And you can share, yeah.
All right, let's see if I can get this to work. Share sound, so hopefully that's
great.
All right, so David, which screen are you seeing? Because we keep having this problem.
You are up. Go back to your display settings and hit that.
Okay.
You're good.
Swap it. There we
Go
go.
up.
Is that the
Yep,
right side?
you are set to go.
All right. Well, good afternoon, everybody. As David mentioned, my name is Aaron Kitzman, and I am a program administrator with the Sheriff's Office in Ventura County. I work at the Crisis Intervention team. I wanted to just give you a brief background about me so that you knew what I brought to the table. Hopefully bring some credibility, but you can decide that yourself. On the boring side, the educational side, I've got a bachelor's degree in psychology, a master's degree in clinical psychology, and I am a licensed marriage and family therapist. On the work employment side, I spent 26 years supporting people with intellectual and developmental disabilities. So I started as a direct care staff at a licensed group home, moved over as a case manager in a licensed day program. I then got into management in ILS and SLS services. Decided to go over to the regional center for about 8 years, where I held 3 different positions. One was an enhanced case manager position, which that actually doesn't exist anymore for funding reasons, but it was basically like a service coordinator. Then went over to quality assurance, then went into management. And as David mentioned earlier, then I spent 12 years as a vice president at a mid-sized nonprofit that worked in both Ventura and LA counties. And I was responsible for operating 19 of their 22 programs. So then COVID came around, and mid 2020, through some discussions with my family, we decided I was actually going to retire. And so I started serving on a bunch of boards, and then this position became available. And I had some background in the position because I had actually was a volunteer instructor for the program, which we'll talk about in a bit, what that means. I applied, and about 6 months later, they hired me on. So I've been here for just under a year and a half at this point. So still fairly new as a staff, but again, I have some experience. So at this point, just wanted to let you know where I was coming from. We can proceed. What we're going to cover today is basically mirroring what was on the flyer that Mr. Grady had sent out when he was advertising for the class. So we're going to talk very briefly about crisis intervention training and what our program does to try to assist law enforcement in Ventura County to have better outcomes when they're interacting with people with that are either in a mental health crisis or have an intellectual developmental disability and are in crisis. We'll talk a little bit about 5150 and 5585, which is part of the Welfare and Institution Code, and a little bit how that impacts people that are living with an IDD diagnosis. And then lastly, Mr. Grady wanted me to discuss a little bit between the differences, the pros and cons really, between 911, 988, and then crisis support services. So we're gonna get going. Firstly, got to start at the beginning. So how did crisis intervention team come to Ventura County law enforcement? So basically in the late 90s, there was a series of officer involved shootings really throughout the country, but even in Ventura County. And anytime there's a shooting or a significant use of force, even if the shooting was quote unquote legal, it's still not a good situation, right? People could end up hurt, possibly dead. Public confidence wanes. There's often litigation. It's just not a good situation. And so the leadership at the time basically said there's got to be a better way to do this. And so they started doing some research. And in May of 2001, my boss, who at the time was a sergeant with Ventura PD, along with another member of law enforcement and a doctor from Ventura County Behavioral Health, went up to San Jose Police Department, and they saw the training that they were providing to their officers. And it was called the Crisis Intervention Team Training Model, or the Memphis Model. And we can talk more about later why it's called that if you'd like. But basically, they came back to Ventura County and said to leadership, hey, this is going to work. We can do this. We think it's going to be useful. And so an agreement was formed initially between Ventura PD, Oxnard PD, Ventura County Sheriff's Office, Behavioral Health, and NAMI, which a lot of you probably know is the National Alliance on Mental Illness. And they formed this coalition around this idea about training officers and deputies how to best interact with people in crisis. And then you can see that later expanded to Port Hueneme, Santa Paula, and Simi Valley Police. And we're currently in discussions with probation and another department that I won't name at this time to bring them on, as formal partners. So we've been going since the end of 2001, so 20 plus years in Ventura County with CIT training. This really overdeveloped slide is just to give you a sense of some of the both police departments, law enforcement departments, as well as other nonprofits and agencies that we work with. What you may or may not know is that my supervisor, Mark Stadler, and I are the only CIT people in the entire county as far as people that train and operate the program. There's approximately 3,000 law enforcement officers in Ventura County, so it would be impossible for us to do this without support. And actually, you can see at the bottom right-hand side of the screen, or at least it's the right side for me, you'll see Tri-County's regional center is there. I'm on the phone with regional center at least once or twice a week, discussing things, trying to figure out the best way to serve people, referring people to them for services, letting them know that I've got a police report that someone that they serve has been contacted by law enforcement. And again, this is just a small sampling. If we tried to include everybody that we collaborate with, it wouldn't fit on the screen. But this is just to give you a sense of where we are. Our goals in the crisis intervention program is to help officers reduce the intensity of a crisis using de-escalation strategies. That's partially the definition of de-escalation, but we'll get into that a little bit more later. To reduce the necessity for the use of force, promote pre-custody diversion, which is just a fancy way of saying if somebody doesn't need to go to jail because they're in crisis and there are services out there that could support them, let's try to do that instead of taking them to jail. We know that oftentimes jail is not the best location for the people that we love. And so if there's a way to not do that, let's do it. And lastly, as I sort of mentioned on the previous slide, we collaborate with everybody, but we really prioritize people with what we call lived experience, which is the fancy way of just saying people who either have a diagnosis or people who love somebody and care for people that have a diagnosis, because the perspective that they're going to bring to whatever we're talking about is oftentimes way more meaningful than what a professional with a bunch of letters after their name may have to say. So as I mentioned, I think before we go any further, we need to define de-escalation. Interestingly enough, a handful of years ago, the people in Sacramento who are responsible for setting training standards for everybody in law enforcement, it's called POST, which is Peace Officer Standards and Training, recognized that de-escalation was discussed multiple times throughout the police academy, but they never actually had a definition of what de-escalation was. And so a work group got put together, actually including my boss, and they decided the appropriate definition was de-escalation is the process of using strategies and techniques intended to decrease the intensity of a situation. And they were very purposeful in coming up with the wording of this definition. If you notice, it's a process, it's a strategy and a technique that's intended to decrease the intensity. It's purposely worded that way because what we also talk about is that de-escalation requires cooperation. So if I'm a law enforcement officer and I come in contact with somebody in crisis, I could do everything 100% perfect by the book. I'm using empathy, active communication, I'm reducing the external stimuli, I'm doing everything we train people to do. But humans have self-determination, they have that right. And so if I'm somebody that's in crisis and I'm interacting with you as a law enforcement officer, and you're doing everything you can to help me out, but I take out a knife and charge at you, well, I've made that choice. And so sometimes, unfortunately, it doesn't work. Now, we do know statistically, officers who have de-escalation training are far less likely to have a use of force incident, and they're far more likely to have a positive outcome. But again, it's not foolproof. So we make sure to talk to people about that as well. Going forward at this point, now that we have that basic understanding, I'm just going to give you some very basic sort of broad overview of concepts in psychology that we talk to officers about. Again, there's no way to do this justice in the 20 or so minutes I have. So if you have additional questions at the end, please feel free to ask. But again, this is just a very broad overview. When we're talking to officers, and by the way, I use the term officer and deputy interchangeably. I should have mentioned that. When we're talking to officers, we let them know that de-escalation is important and it has benefits, improves public trust, reduces danger, improves community cooperation, which by the way, in Ventura County is outstanding. We're very lucky here in Ventura County. When I talk to people who work in other counties, they're a little bit jealous actually. So thank you all for that. And then obviously it has a positive impact on personal wellness. Officers and deputies don't like to use force, at least the majority of them. So when they have to, it can wear on them. So it's important to try to do this. We spend a lot of time talking about the importance of communication. There's multiple studies, probably a lot of you know this, that the verbal words that you say are only 7% of the communication that somebody hears. So body language is important, tone is important. And the other thing we mention is it's not what you say, but how you say it. And that is so, so important. And actually, if it works, I'm going to show this really quick video here to sort of highlight that point. And it's something that we talk about over and over and over when we're doing training. let's see if this works.
Call you back. Is this my car?
State Farm knows that for every one of those moments,
This is ridiculous!
there's one of these.
Is this my car? What? This is ridiculous.
This can't be happening!
This can't be happening.
Oh, it's happening, sweetheart.
Oh, it's happening, sweetheart.
Shut up.
Shut up!
That's why State Farm is there.
What?
All right, so again, just kind of a cute video. If you were paying attention, you saw that every single word was identical in both scenarios, and yet obviously they were communicating very different things. And so, again, that's just one of the things that we really harp on when we're talking to officers. Body language is important, tone is important, et cetera, et cetera. We do talk about some psychology 101 kind of stuff, like Maslow's hierarchy of needs, and that only unmet needs motivate. This is really important for a number of scenarios, but as an example, if I'm somebody who has been diagnosed with autism, I don't speak with words. I've been in pain for days and days and days at a time. My caregivers, my family isn't able to figure out what's wrong with me. Maybe I have a toothache or something. Of course, I'm going to get frustrated eventually. Of course, I'm going to start acting out. I'm communicating that I have an unmet need. So for you and coming in and talking about finding me a job just doesn't make any sense, right? You need to try to meet me where I am and try to understand what my needs are. Am I feeling unsafe because I have an anxiety disorder? I have a toothache and that need isn't being met. So again, not just coming in and trying to solve the problem, but trying to understand where people are, trying to meet them where they are, and then trying to help identify a solution. I don't actually like this slide, but unfortunately it's a picture, so we have to use it. The background I find a little confusing, but the concept is excellent. So one of the things that we're reminding officers about is all humans on Earth, when they are feeling very stressed out or in a crisis state, they're going to react in one of these 4 ways. It's a given. So they're either going to want to fight. Everyone's heard of fight or flight, right? They're going to want to fight or run away. But there's actually 2 others that scientists have identified, which is freeze, which literally is what it says. They just freeze and can't move. They can't act. Or fawn, which is trying to convince the person that's threatening you to not hurt you, in essence. And so we remind officers that anybody you contact that's in a crisis is going to react in one of these 4 ways. And by the way, the officers will react in one of these 4 ways as well. Now, the advantage to Ventura County is the police academy that they go through is called the Stress Academy, which is just what it sounds like. But what that does is it forces them to be under stress for 6 straight months. And it helps them identify which of these 4 ways they react and figure out ways that they can fight through it so that they can serve the community. But going back to the person that's in crisis that's contacted by the officer, when someone's in one of these 4 modes, they're using a part of their brain called the amygdala, which is sort of the top of your neck, back of your head. And that's the part, it's sort of the oldest part of our brain. It doesn't allow for rational thought. It's just reactionary because, hundreds and thousands of years ago, when you were walking through the brush and you hear something, is that a tiger or is it a rabbit? And you need to react for survival. The goal is to try to slow things down as much as possible, use the communication tactics, use a bunch of the other tactics we talk about, so that hopefully the individual you're speaking with can start thinking with their prefrontal cortex, which is the part of your brain in the front, kind of at your forehead. And that's the part that allows for rational thought. And so if we can help people transition from amygdala to prefrontal cortex, we've got a way better chance of having a peaceful outcome. So again, just some of the basic concepts. So then the question is, how do we teach these? Where do we teach these? When does all this happen? So there is something called the CIT Academy, which is probably what we're best known for. But before we get there, I just wanted to mention, I've said, I think twice now, that we have a 6-month police academy. And my boss will tell me that when he was going through the police academy in the late 80s, it was also 6 months, but they literally had 2 hours of instruction on mental health. There was basically nothing on intellectual developmental disabilities. And of those 2 hours, 1 hour was how to fill out the paperwork when you've had contact with somebody, which means they in essence got 1 hour of training. Okay. Now, while the recruits, they're called, but the individuals in the police academy are there, my boss and I get them for 12 hours where we talk about nothing but mental health and intellectual developmental disabilities. What are some of the common traits and characteristics you're going to find with each of them? What are reasons that you're likely to be called out as a police officer for someone with those various diagnoses? And then ultimately, what are some ways that we would recommend trying to approach somebody to end up with a positive outcome? In addition to that, he and or I are auditing about 25 hours of additional classes that are taking place so that we can ensure while other instructors are talking about things like use of force, for example, that we can provide input and say how de-escalation strategies and techniques might be useful into those circumstances. So, in the past it was 1 hour and virtually 0 on IDD, and now we're at about 40 hours. So as somebody who's lived this world and who has a child on the spectrum, I'd love it to be a lot more than 40, but to go from 2 to 40 in one generation of police officers, that's pretty good. Then to make it even better, they go through a 6-month police academy. They graduate on Friday. They get Saturday and Sunday off, and most of them celebrate and sleep a lot. And then Monday morning, they come to us for a 40-hour training. So before they ever work a single shift as a law enforcement officer, they come to us for an additional 40 hours of training. And I'm going to show you in a minute what that training is composed of. But since 2001, just some basic statistics, we've trained 2,200 people. It's actually a little over 2,200 people, to include law enforcement, 911 operators, which is what communications operators is, probation, and others. And interestingly enough, this 40-hour training requires, the last class required about 65 instructors to put this training on. And a lot of you, I'm guessing, are thinking to yourself, how the heck do you need 65 instructors for 40-hour training? Well, let me show you. So this was our schedule at our last CIT Academy. Now you can see with the purple arrow and the yellow and red, I've highlighted the section on the intellectual developmental disabilities. So I'll just tell you a little bit about that. It's our second longest single section of training. So it's 1 hour and 45 minutes. The longest one is 2 hours. So it's pretty close. It's right up there. The first hour is taught by a clinician. I used to teach it. Remember at the beginning, I mentioned I was a volunteer instructor. That's what I did. The last class, you can see Dr. Graff taught that first hour. And for those of you who don't know, he's the clinical director at the regional center. And his job is to spend an hour talking about what are the 4 primary diagnoses that allow someone to be eligible for regional center services. So autism, cerebral palsy, epilepsy, and intellectual disability. Again, what are some of the basic signs and symptoms? What are ways to approach people? Why are you likely to be called out? It's sort of a reminder of what they already learned. But then we bring in, you'll see at the bottom there, it says Janine and Brandon. So we want to make sure that people with lived experience are part of this training. So Janine is the mother of Brandon. Brandon's in his early 20s. His diagnosis would have used to have been called moderate autism. I know now it's a numbering system, so I'm not sure how that works at this point for him, but he's somebody with limited speech. He's got some impulse control challenges, some sensory challenges. He's had elopement issues in the past. And so they're able to really come out and say, look, this is what it's like in real life. This is how, if you approach Brandon, he might react to you. Here's some things that have been important to us. Here's previous law enforcement contexts that we have had. And this is what has worked and this wasn't, and what didn't work. Now, of course, I have to remind people that just because it worked for Brandon doesn't mean it works for everybody else. But it's still, I can tell you that those interactions mean a lot more than Dr. Graff up there talking about nuts and bolts of autism, right? Because it's just real world. The reason we need so many instructors, you can see Monday, Tuesday, Wednesday, Thursday, it's almost all in-class instruction. So of those 32 hours, 30 of those hours are them sitting in seats listening to lectures. Friday morning, I don't know if you can see my cursor, but up here at the top, we force them to prove that they've understood what we've said. And we do that by forcing them to go through live scenarios. So we have people from either behavioral health, law enforcement, or other professionals are acting out live scenarios, and we have officers approach them and they need to interact and come up with a solution in real life. And then we have experts monitoring them and providing feedback. Hey, you did this really well. This is an area you might want to work on to get better. And here's some solutions on how we think that might work. So it really does force them to prove that they've understood, at least at a baseline level, of what we're talking about. But you can see we've got lots of topics in here: bias and discrimination, there's de-escalation, we talk about 5150s, we talk about, well, here's crisis support services, we'll do that later. We have NAMI, et cetera, et cetera. So this is a 40-hour class that all officers in Ventura County are required to go through at this point when they graduate from the academy. So just some real quick closing thoughts that we talk to officers about before I move on to the next sort of section of the presentation. We talk about euphemistic labeling. That's just a fancy way of calling people names. So as an example, I'll look at the bum over there, look at that horrible immigrant. And we remind people that if you catch your partners doing that, you need to put a stop to it right away. Because if you look back over human history, or, you know, the R word for us, right? You look back at human history, when can we do?
Oh. Aaron, we just lost your microphone. Check, Aaron. No. I don't know what to recommend. It might be your headset. And it's,
Can you hear me if I do that?
there you are. Now you're back.
Except now I can't hear you, so hold on.
Okay, well, put your headphones back on because you're back just like you were.
There we go. Well,
Okay.
I'm doing this because I'm at the station and sometimes the radio gets loud, but if the headphones failed, let me try this. I apologize for the technical challenges. Let's see if we can get this back.
I almost had a flight response, Aaron.
Oh, there you go. Oh, with all this stuff at the top, I can't see my
You are at
oh no, it's not that. I just can't find the
from current slide. There you
there
go.
we go. All right, I apologize, folks, for the technical difficulties. Anyway, euphemistic labeling. So I'm not sure where you lost me, but no time in human history. You look back across human history, and that's when we do bad things to people, as we label them. Now we can see them as less than us, and then it gives us permission to do unspeakable things. Make a good movie. That's just reminding officers and deputies that they are all on camera. Every single officer in Ventura County wears a body camera.
Mm-hmm.
And everything they do is being recorded, which frankly is a good thing. I love that. Helps keep people accountable and honest. Respect for human life and dignity. Hopefully that goes without saying, but we do touch on that. And then de-escalation requires cooperation. So we talked about that, obviously, throughout the presentation. So again, that's I don't know what that was, 10 slides of something that we spend 40 hours talking about. So obviously, if there's questions, feel free. But I'm going to go ahead and move on for the sake of time over to the 5150 and 55.
Yeah, you're doing good on time, and let's hold off questions till afterwards. I'm gonna make some pointers too. I think we got enough here for a good start to a robust conversation. Yeah, tell us about 5150, Aaron.
Okay, so 5150 is just the code in the Welfare and Institution Act, or Welfare and Institution Codes. It's actually called the Lanham and Petrus Short Act, or LPS Act. By the way, it's the same act that allows for conservatorships in our world. So just just as a thought there. But basically what it says is, well, and now it's failing again. Can you hear me?
We can hear you. There you go.
So what 5150, so 5150 is for adults. Let me preface it with that. So 18 and over. And it says, as a person, as a result of a mental health disorder, is a danger to themselves, others, or is gravely disabled. Gravely disabled is just the legal way of saying they can't care for themselves. Okay, 5585 is the same thing for a minor, except for a couple of things. For a minor, the law is a little bit different for two reasons. Number one, we don't expect a minor to be able to care for themselves. We don't expect a minor to be able to provide their own food, to provide their own shelter, right? That's responsible of a guardian, a caregiver, etc., parent, hopefully, right? Where that would come into play is if, let's say, I had a 10-year-old daughter, I'm giving them food and they're refusing to eat it because they said there's aliens inside the food, and if they swallow it, they're going to get sucked up into a spaceship and taken away, right? So there's that. The other thing is, if you notice on the last part of 5585 where my cursor is, and authorization for voluntary treatment is not available. So with youth, people responding who are considering writing a 5585 are required to try to contact a parent or legal guardian and see if they will consent to voluntary treatment. Now, these two acts, what they do in Ventura County is allow law enforcement to involuntarily detain people, i.e. put them in handcuffs, and take them to an appropriate facility for treatment, evaluation, and crisis intervention. In Ventura County, what that means is you're going to get put in handcuffs, put in the back of a police car, usually, sometimes ambulance, and taken to the local emergency room. When you're at the emergency room, you can, well, once you're put in handcuffs, you can be detained up to 72 hours. And during those 72 hours, the emergency room doctors, usually psychiatrists, are supposed to determine if you are a danger to yourself or others, or if you're gravely disabled. And if you are, they can legally detain you against your will for longer. And if they don't think you are, they release you. So this is not an arrest. It's actually considered a detainment, and it's not criminal. It's a civil hold. But this is where things get really challenging for the folks that we love and care for. So, for example, I have a 16-year-old on the autism spectrum. The law in multiple places indicates that intellectual developmental disabilities are not considered mental health disorders, which means it would not be appropriate for law enforcement or a county behavioral health crisis team to use these codes to involuntarily detain somebody who has, say, an autism diagnosis, to take them, even though they are in crisis. And I can tell you that when we talk about 5150s and 5585s, the complaints and calls that I get most are autism. So somebody has eloped. They can't tell the officers or deputies where they live. They're out in the street. They're spinning. They're doing things that the officers find unusual. But they're also aware that they can't 5150 them. So they don't know what to do. The other one is dementia, by the way, a little outside the scope of this conversation. But for those of you that maybe have elderly relatives, just know dementia also does not qualify for a 5150. But like I said, there's actually multiple sections in the law that specifically say intellectual disability, epilepsy, and other developmental disabilities do not constitute a mental disorder, right? So what we tell officers and deputies is, if you are told that the only diagnosis the person has is one of those 4 qualifying diagnoses for regional centers, you can't use this code unless they also have a diagnosis of, say, depression, and the symptoms that you are seeing mimic those of depression. Then you can do it. Or you get called out to something, you have no information about what their diagnosis is, so you don't know that they have an intellectual disability, right? But you see them and acting in ways that either are a danger to themselves, others are gravely disabled, then you can do it because you don't know that they have an intellectual disability. You're basing it on the behaviors that you're seeing, okay? So there's some gray area in there for sure. And I can tell you that there are times that the officer will write in the report that they're 5150'd somebody and they know they have autism. And when I talk to them on the side, they say, look, this person needed help. I couldn't get a hold of anybody. I didn't know what to do with them. And I'd rather take them to the emergency room where there's nurses and doctors than leave them on the street. Which on one hand, I appreciate and applaud the empathy and the care. On the other hand, technically, it's not legal, right? So there's this balance. So your loved one is having a crisis. Do you call 911 or 988? And I can't see a show of hands because of my screen, but I'll bet you if I asked you how many people knew what 988 was, we'd get a pretty low number of people raising their hands. 988 actually, well, let's start at 911. Sorry, we'll go in order. I got ahead of myself. So 911, when do you call 911? To save a life, stop a crime in progress, because there's a fire, because there's a serious car accident, things like that, right? They're the things we're all aware of. What we don't want to have people calling 911 for is because your power went out, okay? Or because you can't pay your rent, which is kind of a crisis, but that's not really what 911 is for. Or you're driving home. This happens a lot with our 911 operators. You're driving home and 3 houses down from you, you see 5 police cars. So you call 911 because you want to know what the heck is going on. And that makes sense. But the problem is now that ties up 911 for a non-emergency. With that being said, if you see in the middle of the screen here, if you see my cursor moving, this 654-9511, that number rings into the same exact center where the 911 operators are. So those individuals have access to all the data, but the people answer this phone are not responsible for answering the 911 calls. So this is a number that you can call if you want to get a hold of somebody, but it's not to stop a crime because somebody's dying because there's a fire, right? The other number I like to put out here is 211. That's a number run by the county. The county contracts with a nonprofit organization. I think it's Interface, if I remember correctly. And they have access to like every nonprofit in the county. So those are the people, if your power is out, if you can't pay your rent, if you've got a leak and you don't know what to do, you need sandbags because there's a flood, there's a fire, you're not sure where the shelters are. They've got access to everything, and they're staffed 24/7, and they're Spanish and English speaking. Sometimes they have other languages. That's just kind of hit or miss. But that's also a good number to keep a hold of. So 988. I started talking about this, but let's get to 988. So 988 replaces the National Suicide Hotline. So it used to be an 888 number that nobody could ever remember. So they decided to shorten it to 988. Now there's really good news with 988. First of all, let me be clear, it's not only suicide, it's also a mental health crisis. So somebody is feeling depressed, they're thinking about maybe killing themselves, maybe not. Someone's having an anxiety, a panic attack. They can call or text 988. It is a warm line, which means somebody will answer 24 hours a day, 7 days a week. They're never off. If you look at the bottom of the screen, you can see all the various things that they are trained to deal with. Now, I called the supervisor at 988 a couple of days ago in preparation for this discussion, and I asked them, what training do you have in intellectual developmental disabilities? And she said, we kind of get a brief overview. We have access to a lot of additional training if people want it, but they don't necessarily have the same level of training as, maybe you do, I do, regional centers, et cetera. But it is better than nothing, and they're available 24 hours a day. And again, sometimes people just want to talk. They just need someone to talk to. They're feeling alone. They need someone to reach out to. And because they can call or text, especially for some of the younger generation that prefer to text, it's really an important number for us to get out there. And these screenshots I literally just took from their website. So it's easy to find, but it's easy to remember, right? 988. You don't have to remember 888 and 7 more numbers and go there. So we're really pushing this number out there and trying to get people to utilize it. By the way, it's also, if they believe when you call 988 that you need an immediate response, they will forward that call to 911. So they do have that training to do that. My guess is some of you on this call have heard of crisis support services, but I threw this in there because, as I mentioned, 5150 is usually not appropriate for people that we care for, that we love, and maybe yourself on the call. Crisis Support Services is a vendor of Tri-Counties Regional Center. You see their numbers there. They are the crisis response team for people with intellectual developmental disabilities. So they have been specifically trained to go into the field, to go to a family home, to go to a group home, to go to the supermarket down the street, because that's where the crisis is, and try to help de-escalate the situation. Now, they cannot go hands-on. So if someone's really having a problem, they can't restrain them or anything like that. And they can't transport, and they cannot write a 5150 for obvious reasons, because people with intellectual developmental disabilities are not appropriate for a 5150. But they are a service that is available 24/7, 365, and can assist. Now, when I talk to the regional center, they've told me that you call crisis support services, if they don't already know you or your loved one, will call the regional center. And if you're served by the regional center, they'll get verbal authorization, even if you've never worked with them before. And as I think you probably all know, regional center has a manager that's on call 24/7, and they have the authority to do that authorization verbally so that crisis support services can go out and assist you or your loved one. So it is a resource that's somewhat underutilized. It is available, and I encourage you to learn more about them. This was the flyer off of their website. So again, it's easy to find. And I think now I'm going to turn it over to David. I did put my phone number and email on here if you have additional questions that we're not able to get to today. Mark Stadler is my boss. So Mark actually helped start the CIT program in Ventura County in 2001. He's been in law enforcement for pushing 40 years at this point. He retired as an active police officer, as a commander 8 or 9 years ago, and has been full-time with the CIT program since then. So he's an outstanding resource for our county. But anyway, our numbers are down there. So again, if in the next half an hour, whatever it is that we have left, if we don't get to all the questions, or if you think of something later, because I know that happens in the heat of the moment, then we hang up and you go, oh, wait a second, feel free to reach out to me. With that, I'm going to turn it over to you, David, unless you think I missed something. I'm happy
Oh, no, Aaron, it was great. It was just great. I appreciate it. So I believe we have a little icon that you can raise your hand if you have questions. I'm going to, so do that, or if you're more comfortable with chat, do that. A couple of things I want to point out. Number one, in terms of negative interactions with police departments in these 911 responses, we do want to kind of highlight the significance of the issue. People of color, underserved communities, people of color, and those with people of colors with disabilities are 5 times more likely to have a negative interaction with law enforcement. This is a nationwide statistic, probably not Ventura, but again, it highlights the vulnerability of our community with disabilities. Really want to maybe go into a conversation about de-escalation, Aaron, because I believe that's kind of a lot of these things that Aaron's talking about, we weren't talking about 10 years ago. This is all new. And things are maturing. 988 is maturing. Crisis response is maturing. So things are evolving. I think Aaron brought home the point that he is doing a broad outreach to law enforcement about crisis intervention training with the awareness of people with developmental disabilities. But we need to continue that outreach. We need to broaden the circle so that dispatch has awareness about IDD, that 988 has awareness about IDD, that you mentioned probation. Probation officers don't know much about special education. And so they need training on IDD and special education services, and they're hungry for that. So we really
Can I just interject one thing I forgot to mention, but you reminded me. We also do presentations for community groups. We get calls all the time for 2 reasons. One, they just want to know what the heck we're doing. But the other thing is we've started getting calls even from city and county saying our staff have been interacting with people where there's been threatening behavior and we want to know more about de-escalation. Right. So we go out to them and we say, look, we're not training you in de-escalation because you're not a police officer. We're only certified to do that, but we can give you all the same concepts and then you can decide what's appropriate.
Yeah.
The other thing is you mentioned probation. It made me think about this. Post, Peace Officer Standards and Training, recognize that like any other skill, CIT, de-escalation are perishable skills. And so they're recommending every 3 to 5 years that all officers and deputies take an update class. So I don't know if you'll be able to see this on the screen, but anyway, we have 6 update classes, and the reason it made me think about it is next Tuesday we have one, and there will be 12 probation officers coming to that class. So again, because we recognize that there was that gap in training and understanding, we've reached out to probation, and they're wanting to become an official partner. So. And then
another group that needs to know is jailers or custody and then in incarceration. There is the state of California definition of developmental disability, and then there's a federal definition of developmental disability. The federal definition of developmental disability is more broad, and therefore there are a lot of folks with developmental disabilities who would qualify under the federal definition who also interact with law enforcement, and that is one of our most the knowledge about that community is not so strong. So again, we're asking a lot out of officers. That 40-hour training that Aaron shared, it's like mini grad school. They are getting a bunch of training in a week's time, and so you really do come out with a pretty well-educated law enforcement team, but it's just a lot of information. Then finally, before we open up to the floor, I want to talk about co-occurrence. So Aaron brought this up with the 5150, that truly a developmental disability is not a behavioral health disorder. It's not a mental illness. You're not sick. It doesn't fall into that category. What we're talking about primarily is co-occurring disorder. So it's behavioral health disorder co-occurring with intellectual and developmental disability. If you look at regional center statistics through their SANDIS, you're going to find that statistic between 10 and 15% of the population. And that's not uncommon for the general community. But when you throw in the issue of trauma, particularly trauma and complicated trauma or post-traumatic stress, that number can go up to 75%. And this is due to our community, people with developmental disability, being subject to bullying. So it might be something as parents you're familiar with, the bullying problem. And oftentimes I meet people with developmental disabilities who often go back and talk about how they were bullied in school. And their response is generally an anxious response, an anxiety disorder response, a PTSD response. So back to that 5150, you might want to broaden your definition of co-occurrence if there is that trauma feature to it. Two issues. Back to training. 5150 is not the ideal location for a person with a developmental disability, nor is a psychiatric hold. There are really no ideal locations. We're not strong on transitional housing for people with mental illness or developmental disabilities. So we will, in this summer series, is to go into some of these complications about, well, what do we do? And how, so we're going to talk about treatment, about regional center responses, and we'll also talk about how the family can maybe do some things. But that idea about de-escalation as family members, it's not a bad idea for you to get some de-escalation training if your child is prone to anxiety responses or meltdowns or behavioral health disorders. Having some de-escalation training as a family is not a bad idea. I think that's it. I think that's it.
Yeah, on the trauma, that's really important. We actually do talk about it. I emphasize it, but years ago when I was doing my internship to get my MFT, we have to do 3,000 hours of internship. I worked at a place that was doing domestic violence and sexual assault work. And I think the statistics haven't changed, unfortunately, but it was something like 1 in 3 or 1 in 4 women by the time they're 18 years old will have been assaulted in one way or another. And it's hard to get the statistics for people with intellectual developmental disabilities, but I've seen studies that show as many as 6 in 10, 8 in 10. I mean, the numbers are ridiculously high.
Right.
And the more capable somebody is, the less likely that is to occur, but still. And so again, that comes with trauma.
And so really one of our challenges that law enforcement is faced with, it's a challenge for MFTs too, is what's called differential diagnosis. Which is the disability? Which is the developmental disability? Is this a behavior associated with the developmental disability? Or is this a behavioral health issue? Is this a mental illness? Is this a hearing voices, that sort of thing? So in a crisis situation that we're putting just the nature of the beast is there's a real need to kind of figure out differential diagnoses. So be patient with law enforcement as they're trying to figure this out. They're not skilled in this area. Those who are skilled they aren't great at it either, because quite honestly, in our training of behavioral health care workers, counselors and therapists, IDD is not part of the curricula. So what we're doing is we're seeing the results of our success, that being more and more our services are being provided in the community. And so more and more we're needing our community safety net to be trained on people with intellectual and developmental disabilities, much more so than Aaron and Harry probably know about from running programs 20 years ago when it was a completely different system of service delivery. All right. So let's throw it out there. No hands are raised. Be careful if you don't raise your hand, I might call on you. Does anybody have any questions? Jonathan, I see your hand up.
Thank you, Aaron, so much for everything. So a quick community clarification. So I have the VCBH crisis line is 866-998-2243. Is the numbers that you showed earlier preferable for people with IDD?
Yeah, so if you call that number, they're going to respond. But again, their training is all in mental health.
Gotcha. Okay, so it's just like for regional center clients that we prefer to use those other numbers then.
Yeah. So the advantage to calling the behavioral health number is they can write 5150s, right? The crisis support services team cannot, right? And 911 can as well. So again, if you're serving somebody or you love somebody or you are somebody that has an IDD diagnosis and a mental health disorder, and the feeling is whatever crisis is occurring has gotten to the point that they might need to go to the hospital because they need a med adjustment or whatever it might be, then the behavioral health crisis team might be a better option because they have the ability to do that.
Right. So I guess that's kind of, I've had two family members that I've had a call crisis team on, and one potential deficit disorder, my mom with dementia and assisted living, and even clients and other my professional network, we're not getting the crisis teams to respond, including BPD. And to me, I kind of feel like this is a little bit of medical discrimination, that we have these dually diagnosed individuals. And when I think of some of like the, DSM diagnosis criteria, we don't see like danger to self or others. That's not really, part of the medical definitions here.
Right.
And we have people that do enter these crisis situations that need immediate assistance. I know this is not part of, my mom with dementia. I had to call 911, get her medically transported to VCMC, and they were frankly threatening to throw her in a geriatric psych facility in Bakersfield, which would be totally helpless, right?
We don't have any in Ventura County.
Exactly. I would have taken the one in Downey, at least it's cleaning my grandma's house. But it's really this point of entry that I think families are struggling with. So questions like, how do we deal with this? Because so many individuals and families won't take help unless it's dire. And then David, thinking longitudinally here for a follow-up here, how do we get the services connected? And I think even like Vista Del Mar was shut for intake in Ventura County for several months. So where are we going with all of this? How do we get a little bit more capacity in the systems to help everybody?
Yeah, Vista did lose its LPS status, which means they can't take anybody involuntarily. They can still serve people voluntarily. But as we've talked about, I think David mentioned this, somebody has, say, an autism diagnosis and they have sensory issues, the emergency room is really not the best place. Or a psych hospital where you have people screaming and throwing things. And also, unfortunately, I guess, they just don't have training in IDD. And so they get folks who have an intellectual development disability and they don't know what to do. And you don't want them chemically restraining them.
Right.
I've been there with my mom. Yeah.
Hey, Aaron, you talked about crisis response team, the vendored service, crisis support services, the vendored service of regional center. Ventura County has mobile units now, don't they?
For crisis support services?
For crisis.
Yeah.
So the other category of people that we want to do broader outreach for are these crisis support teams. This is in response to well, you can say it's in response to the kind of the George Floyd situation, the increase in mental health in community situations. Our crisis support teams are effective, and they're one of their strong points is they're strong with de-escalation. So I know you have that question. Well, 5150, emergency psychiatric, those aren't the best places for our folks. Truly, the best thing is to try to de-escalate the situation, to get it to a point where the person can remain where they are. If the family's having a difficult time with that, I would encourage the 988 call and request for a crisis support team. And then in cooperation with the crisis support team, talk about their IDD and how they might want to create that space of safety so that the individual can kind of get through their crisis. Aaron, what are your thoughts about that?
For sure. And the more information you can give the 911 or 988 person, the better. So as an example, when I'm talking about autism, we know for some people with autism, they can get hyper-focused, they can perseverate on something, try to find out what that thing is. Because if the officer can show up with a little toy truck or something, that bridges that gap because the person likes trucks. Now you've got something to talk about. Now you've got a way to connect. Now you can develop that rapport and the empathy, right? So we talk about trying to get as much information from families as possible. And that's not always easy because sometimes families have not had good interactions with law enforcement. And so they're reticent to share because they feel like that's going to lead to a negative outcome. But the more you can give them, the better. But no, when it comes to crises for people that regional centers serve, there are limited resources.
Right.
Our systems just aren't set up for it. And I've been fighting this fight we're almost at 30 years at this point.
Well, and this is a priority of state council, this priority of Aaron and the counties. It's a learning curve, and what we have to do, it's a long-term solution. I know, Sandra, your hand is up. I'm going to get to you in a minute, Sandra, and we have this interesting question in chat. Oh, I had a point. I was going to make it. It was going to be a very important point. Um, oh, the crisis intervention. The goal of crisis intervention is to eliminate the crisis. It's not to provide treatment. It's not to provide therapeutic treatment. You're not going to get your what you'll hope to get is the crisis calm down, a recognition within the family system that there may be a behavioral health disorder here, and some references on how to reach out to the therapeutic community, maybe start treating the thing that caused the crisis. But the goal of a crisis is to get the person to return to that homeostatic state so that they can be no longer a danger to themselves, to other people, to not be gravely disabled, and not be destroying property or anything like that, just so they can kind of calm down. So as family, be aware that, you're not going to, the healing is just starting. It's not, the crisis team is not going to cause the healing or complete the healing part. Sandra, your hand was up, but it's down again. Go ahead and ask your question, Sandra.
Great. Thanks, David. So I'm up in the San Jose area. My son has autism and significant mental health challenges, but he is not a regional center client. But Ventura County is close to my heart. I was born and raised in Thousand Oaks, and my father just retired from a 30-year career at Tri-Counties Regional Center as a medical provider. So thank you for this session today. And a couple questions that come up for me in hearing your presentation, Aaron. You spoke quite a bit about the handcuffs, and my son's first crisis was when he was 11. And I'm just wondering why we go to handcuffs, especially with our children, especially children with sensory issues. Then you're restricting their movements. If they need to stim, they can't stim. So I'm assuming that once they get to the hospital or get calmed down, they don't need handcuffs. So I'm wondering why there is that, why that is part of the process and the protocol.
Yeah, sometimes at the hospital, people stay in handcuffs, but sometimes they don't. To answer your first question, though, is it's just an officer safety and an individual safety. Unfortunately, people get put in the back of police cars and they end up hitting their head on things and throwing things and hitting themselves. With that said, an officer or deputy can contact their patrol sergeant and say, can I not put them in handcuffs because mom has said that, I'm making this up, right? But if they don't do this, it's going to send them over the edge and it's going to get worse. So they can ask for the exceptions, but policies are anybody that goes in the back of the car gets handcuffed. The other thing is sometimes you or somebody can request an ambulance, and they AMR, which at least in our Ventura County is the contracted ambulance company. They have a couple of ambulances that are designated for non-emergency transport, and often that means 5150s. And so they can get called out and then people can get put in the back of the ambulance. And then the police will just meet you at the hospital. The police will turn over the report, the 5150 report, to the nurse. And then that'll be that. So sometimes there's a way to do it that way as well.
Okay, great.
Yeah, and again, I think that crisis response teams don't handcuff. Crisis response team will rely on law enforcement if they feel their safety is in jeopardy.
And so all of the crisis response, whether it's behavioral health, crisis support services, if there's a fight or flight risk, they will not approach, because law enforcement are the only people trained and have the legal authority to go put their hands on somebody. Right. So even fire, by the way, fire won't approach if somebody's bleeding, but they're still threatening. Fire won't go in either. So it's not just the crisis people. By the way, it's the same at the hospital. Officers or deputies will bring someone to the hospital for a 5150. And if the nurses feel like the person's a fight or flight risk, they'll require the officers to stay there. Because again, a lot of people don't know this. Here's a little secret. Except for one hospital in Ventura County, all of the security guards are there for show. They're not allowed to go hands-on. So if the person is threatening, they're not allowed to touch you.
Well, I think that's nationwide because of the lawsuit risks for that sort of thing.
So there is one hospital in Ventura County who has a contract with Ventura PD to have an officer in the emergency room most of the time. But yeah, so they won't go hands-on.
Okay.
So Sandra, I know you had another question.
Yeah. So my other question is, we seem to repeatedly see excessive use of force used, and by that I mean using a gun, shooting someone either in the shoulder or unfortunately to kill. When I think the example you mentioned, Aaron, is, have a knife and they're approaching and they're not able to de-escalate the situation.
Mhm.
I'm wondering if your officers in Ventura County are ever trained on martial arts so that they could very easily and safely disarm someone with not a firearm, but with another type of item that may be determined as a weapon, which we often know end up not actually being weapons. And then you are able to de-escalate the situation in a way that is safe for both the officer and the individual, but that doesn't require an excessive use of force.
So in the academy, they get grappling training. It's not really, they're not becoming black belts or something, but they are taught how to, if they end up going to the ground, pressure points, restraints, and things like that. Unfortunately, if someone's charging at you with a knife, you're pretty limited, especially if you're by yourself. And the way the law reads, it's what did the officer think, believe, and feel at the time they pulled the trigger, and was that reasonable? And reasonable basically means what would other people with similar levels of experience and training do, right? So just as an example, people often ask why, if I'm a deputy, I show up to a scene, I'm working with you, and you raise up a knife, say, kill me, kill me, kill me, and run at me. Right? And they'll say, well, why didn't the officer use a taser? Right? That's a reduced likelihood of the person dying. Actually, that would be inappropriate. And if they did it, the officer would get in trouble. So here's the reason why. The officer needs to go home and see their family too. But also, tasers actually fail 30% of the time. So if the officer's by themselves, or I'm by myself, and you're running at me with a knife, which is a deadly weapon, the protocol is to draw your firearm and shoot if you have no other way of getting away. There's nothing you can put in between you. You can't close a door to block that, things like that. The other thing that's a misnomer, you didn't outright say this, but you sort of alluded to it, is I've heard people say, well, why didn't they shoot him in the leg? And that's not how training works. You're trained to shoot center mass. And the reason is it's really, really hard to shoot a moving target in the leg. A leg is an inch or two, across. And if you've decided you're pulling the trigger, in your head, you've decided it's your life or somebody else's life if it is at risk. You're not allowed to shoot somebody because they're stealing something. That's legally, you can't do that. You have to be protecting your life or somebody else's life. And unfortunately, and I say this in jest because it's not, but even if someone's harming an animal, by the way, you're not allowed to shoot them. I'm an animal lover, so that bothers me, but that is the law.
Yeah, I appreciate that. Sandra, any more questions?
Nope. Thanks.
Good stuff. We have this interesting question from ZL in the chat. And ZL, I don't know if you want to speak up, but I'll read it and then you can speak up if you want, or we can try to answer it. If 5150 is not available for people with developmental disabilities, would you please tell me how to handle a person with developmental disabilities who is at crisis that is screaming and may attack people? Can I call 911? Am I nervous of a person with if I am nervous of a person with developmental disabilities that's screaming and may attack?
Absolutely.
Yeah.
So, attacking somebody is either an assault or battery, depending on how you look at it. That is a crime. People with developmental intellectual disabilities can be charged with a crime as long as the district attorney, which, by the way, officers don't charge people. That's another common misconception. But if a district attorney believes that they could form criminal intent, there's a part of the law called PC 26. You're feel free to look that up later. But PC 26 was actually designed for youth, for children, to determine if they have the ability to form criminal intent. And it's also used on people with intellectual disabilities. And so there are people with intellectual disabilities in jail. I'm actually on an email chain fairly frequently with Darcy Bishop, who, David, you probably know, at the regional center, because she works on the CPP side of things. And there are people all the time in custody that have a diagnosis. And so that's not a get out of jail free card. You can still commit a crime. But to answer your question, if you're feeling threatened, absolutely call 911. There's nothing wrong with that. You can also, by the way, just to be clear, you can call 911 and crisis support services and 988 and the behavioral health team all at the same time if you want to. There's nothing illegal about that. So
Yeah. That's a good point. And again, 5150 is not available for people with DD if the issue of unless they're in a mental health, unless there's a behavioral health component. A ZL, I think also a couple of things that your question kind of has me thinking. One is it's not a bad idea for families or providers to teach our folks with developmental disabilities about how to interact with law enforcement. There is a we have at a family resource center here in San Jose, Parents Helping Parents. There's a couple of videos that go into that. I'll share that with maybe a follow-up email to everyone here today. But definitely train on how to interact with law enforcement. I mean, part of today's purpose is not to solve the problem, but to have families be aware of what you might be getting when calling that 911 number. The other thing that also I'm wondering, kind of spinning off with your question, ZL, is truly, Aaron's kind of pointing it out. There's really not a lot one can do. If a person breaks the law enforcement is to arrest them for breaking the law. So that's choice one. Choice two is a 5150, or choice three is a psychiatric hold. Other than that, and then choice four would be maybe helping de-escalate the situation, getting crisis support team there to help de-escalate, or turning it back to the family. So that 911 call doesn't necessarily mean the problem is going to be solved. It's highly complicated, and authority is given to both the officers, but also the family to try to work out of the crisis. Aaron, am I being a little too specific there, or do you think that's
no? I mean, again, just be aware the 5150 is an application for a hold. The officers can actually, they're not putting you on the hold. They're taking you somewhere to be assessed to determine if the hold's appropriate. When you talk about training the people that we love, at least in my case, that I love, that has an intellectual developmental disability, when I talk about interacting with law enforcement, and I know this isn't possible for everybody, but the first thing that I hammer on all the time is keep your hands visible. Because officers are trained to see the hands, because where the hands go is where the weapons are in dangerous situations, right? So if your hands are in your pockets, the officers don't know what's in there. They don't know what's going on. You're getting close to them. They're getting more nervous. Now maybe a use of force happens. There's a takedown, there's a shooting, whatever. And again, I recognize that for some people that we serve or support or love, they may not be able to do that, especially under stress. They might put their hands in their pockets, or they're flapping or whatever. But I harp on that with my loved one. If you ever come in contact with law enforcement, keep your hands visible. And if they ask you to take something out of your pocket, do it slowly. Because unfortunately, that's oftentimes where things can go wrong.
Jonathan and Sandra.
So a couple thoughts just crossed my mind. Thinking back to the graphic organizer that you have, like all the badges and everything. One organization that I noticed that was missing was maybe VC SELPA or VCOE in terms of building relationships. And I know like SROs are placed by PDs and everything. But definitely building that bridge. And then hearing the conversation, I kind of feel like today is like, well, we don't do this, we don't do this, we don't do this. What would be like the most preferred outcome of calling crisis teams? Or are there even statistics of what happens with a CIT team being called out? Like who ends up on 5150? What calls are resolved through successful de-escalation? Like what are some outcomes that we should be hopeful for today?
I mean, my goal would be
go
officers
ahead.
come out, they de-escalate the situation, the person's calm, and they can remain in their home or wherever it is that they are, their place of employment. But does that happen all the time? Of course not. One of the things I tell people, friends, family, etc., is I've been professionally involved for 28 years now with people within this population. I'm a parent for 16 years, somebody on the spectrum. I have 4 years of college, 2 years of graduate school, right? 3,000 internship hours. I'm a licensed therapist with 3 decades of experience, and I can't get it right 100% of the time. And if I was to assess somebody, it would be in a calm environment in an office with a couch and air conditioning. Law enforcement, oftentimes they're 21, 22-year-old I say kids, I realize they're adults, but kids to me, right? With 50 hours of training, they're sent out to a crisis and asked to do it perfectly right every time. It's really not fair. The problem is that's what we have. Because people call 911, who's going to show up? 90, this is my estimate, 90% of the time, police are going to show up before fire. Why is that? Because if you call somebody at 3 in the morning, where are the fire people? They're asleep. Unless they're out on another call, then they can't respond anyway. But they're in bed asleep. Where's law enforcement? They're driving around the community, right? So they're going to get there first. So that's why it's so important that we're training law enforcement in this. But, you know, we do ask a lot of them. And in some ways we should, because they have the power to take away our civil liberties, and in extreme circumstances, the legal authority to take our lives. That's really serious. But 52 hours of training to handle a significant crisis, and you're 21 years old without a lot of life experience, and maybe you've never interacted with anybody with a disability other than my training, because you don't have a family member or, you know, a neighbor, right? So on one hand, I feel bad for them. On the other hand, they still need to do it right.
Yeah, I don't think we're apologizing for them. I just think we're kind of giving the information to our families so that they are aware that, again, I love that it's this, where I'm using the self-determination principle of authority, that families have authority. And oftentimes if the family can work in cooperation with the law enforcement in a way that is mutually satisfactory, you know, that meets the needs of law enforcement, in a way that's not going to accelerate the problem, but assert your authority to say, you know, my son has this situation, he's sensitive to this is a stimming behavior. Anything you can do to help work with the officer to de-escalate the situation. And again, like Aaron says, we're trying to improve the percentage of successes. We're always going to be worried about the few percent points that we can't seem to achieve. So that's what we're always working
David,
toward.
what is a failure? Are we kind of like jumping to like they're deceased?
No, I would, the
what
way, yeah, one of the statistics I read was a negative encounter, which would be aggression. Well, of course, homicide, but you know, maybe a violent interaction that requires a takedown, you know, those sorts of things. So negative encounters is what I've heard is a term.
And defining failure is a hard thing too, because what does that mean?
Right. Well, even successes too, you know, from my personal experience, I realize that I don't want to generalize this, but getting the people the help that they need to stop. And you know, as you mentioned earlier with anxiety and everything, you lose your ability to think, and you can't make rational choices of like, yeah, you probably should go back on meds. That'll be a good choice for you.
Well, and that's
Some people.
But that's not to be decided at the crisis. That's clinical.
Well, David, why I bring that up though is like, well, how can we get that? And I've again had families that, you know, Vista Del Mar was an appropriate setting for them. And of course, you go through VCMC, Hillmont, you know, down the chain of custody there. But you know, in terms of, you know, what is our success, I think is really important too. You know, are we going to crisis level, and how can we, you know, document what that would be in terms of avoiding relapse or, you know, something like that too.
Yeah, and that turns into a whole planning team discussion, obviously, and insurance becomes a part of it. What doctors do you see? If you're like most people, it's hard to get into the doctor, all of those things. But
well, and that's the number one issue. I think if we didn't have that issue, we'd see a lot less of this. Yeah.
So this is a slide I have on on a training I have, but in terms of crisis stabilization, the person in crisis, 80% of it's resolved over the phone. 70% is resolved, and 70% of the remaining is resolved by the mobile team. 65% remaining are discharged into the community, and then 85 remain stable in community-based care. So, so the statistics are these are, to me, this is somewhat positive. I mean, we definitely hear the sensationalized story, but it does seem if you use 988 and the mobile teams, you're going to have most of your cases resolved. Problem is we don't have a lot of post wraparound care for our community. This is where things get really hard. And this is where families become frustrated. So that, I think, answers your question. And then I see, Sandra, your hand is up. And you're on mute. There you go.
Thanks so much. Yeah. As I was kind of reviewing the graphics, Aaron, when you talked about the definition of de-escalation, and I really appreciated you having that distinction and the definition, I was wondering your thoughts and maybe how this is done in Ventura County versus Santa Clara County. I had a conversation with a local police captain who told me about an incident of an individual with a mental health crisis. And he relayed that they spent 20 minutes trying to de-escalate and they couldn't arrest the person. And arrest was the word he used. So at that point, they needed to de-escalate the situation. So they shot him in the shoulder as a less lethal use of force. So my question is, and this is where I'm hoping maybe there's some learning from your county that could be shared with my county. When you teach de-escalation in your CIT training, do you give a frame of reference of how long this might take? And that sometimes it really, can take a long time, and that you should be in it as long as you reasonably think you can, versus kind of having we tried and no, I couldn't do it quickly. We have other things to do, was kind of the impression that the captain gave me. And then the definition of de-escalation that he used, a less lethal use of force, was de-escalation. And that didn't seem to fit with your definition. So I'm curious about that.
From everything you're telling me, that just sounds wrong in about 100 ways. We actually teach our officers that there are a million studies that show the longer you take, the more you slow things down, the better the outcomes are. Because what we know is, unless it's drug induced or somebody maybe is bipolar and in a manic state, people can't stay in a heightened state of crisis for extended periods of time. The chemicals in our brain that allow us to be in that state eventually wear off, and your body, you just become exhausted. Right. So again, every circumstance is different, but we talk to them about how most people that come into law enforcement are type A personalities. There's pressure from sergeants and others to clear it's called the CAD, the computer system that they use that tells them what calls are coming up. But take your time. That's where you're going to get the better outcomes. Now, there are instances where use of force actually is a de-escalating strategy. So let me give you an extreme example. Okay. You're an SRO, which is a school resource officer. You're a police officer who works at a school, and you see me walking in with a machine gun and I start shooting people, kids. By the technical definition, you shooting me and stopping the threat is de-escalating. Okay. Right. Now that's an extreme example, right? What you've described to me just sounds wrong and bad and a misuse of the concept. And I've never heard of anybody just having a conversation for 20 minutes and deciding to shoot him in the shoulder to de-escalate the situation. I mean, that.
Well, and it escalates.
Doesn't even make sense.
It causes more paperwork that's going to take more than 20 minutes. So.
Well, it's more paperwork. There's internal affair. On TV they call it internal affairs. In the real world, it's professional standards. But there's investigations. The DA gets involved anytime there's a firearm. I mean, it doesn't even make sense. I mean, yeah.
Well, and I appreciate ZL's question again, and then I'm thinking about Jonathan and your question, like what's the best outcome? I mean, for ZL, for the scenario that ZL presented, there's no good outcome. If you lean toward the person with a developmental disability, ZL doesn't feel like her needs are met. If you lean towards ZL, it could lead to the person with the disability getting an arrest. So you're in situations where it's never a win. It's very difficult to come up with a win-win situation.
Yeah. David, I said part of that, even, bringing in schools and having taught in Ventura County Public Schools, there seems to be like he was just learning. He just was finding his space versus, no, that's assault and battery.
Yeah.
Right? So there's got to be that consistent language throughout. And you know, I'm thinking like, well, what should be here? What the most underutilized services from VC SELPA is we can all get NCPI trained. We might not be certified, like go Ventura County, right? You know, Cal State,
Right.
State Hospital invented NCPI basic training there. I use it with my mom. I use it on the street, and just that de-escalation. This is like the best life skill that we can have. So, Aaron, I think even your thoughts on that. What would you like from the community, the professionals, parents? What would help you guys out too?
Well, there's two things that we talk about. So here, I'm based in Camarillo. I mean, I work for the whole county, but I'm here in Camarillo. We have something called Kid Print, and that allows parents and guardians to opt in. It's absolutely not required, but you can give us your loved one's information. Includes a picture, things that they like, things that might be triggers, things that might help with the escalation, so that if someone goes missing, for example, we can find them. The other thing that we like to do is just expose our loved ones to first responders, because frankly, the only time, at least when I was growing up, our loved ones, it was either because somebody was in trouble, there was a crisis, so someone showed up, or they got the tour once, in third grade to go to the fire station.
Right.
And that's it. But
And
those
that's a
visits
wonderful.
both benefit the people with disabilities, because hopefully they learn that first responders can be helpful if they need it, but it also exposes the first responders. And again, a lot of first responders have no personal contact with people with disabilities.
There's an organization in Santa Clara County that has picnics that they invite. Actually, it's their self-advocate community within the organization that invites and has a picnic with law enforcement invited. Lisa, I see your hand up. I'm just going to quickly share this slide. Be safe. This is de-escalation. These 10 commandments you see here take time. That time issue is such a big deal because the need to get the cortisol out of the system takes time. It's got to flush through the liver to get it out of the system. It's got to flush through the liver. It takes about 20 minutes for just one go around. Then if you have a big dose of cortisol, it's going to take more than that.
Time and space. We emphasize that repeatedly. Time and space, time and space. And by space, I mean create space between you and the person in crisis, if it's safe to do so, right? Because other than a firearm, most people don't have weapons that are projectiles. Right. So if you're able to create that space, you're creating safety for yourself as the officer, and frankly, for the person as well. Because that way you don't have to
personal
do something.
Space. Yeah. And truly what you're doing in de-escalation, a person is in a fight, flight, freeze, or fawn mode because they don't feel safe. You want them to feel safe, create safety. And then down here, these acronyms, if you were to Google them, these are all types of intervention techniques for de-escalation.
And we have several slides on LEAPS. I took them out just from a time perspective, but if you want more information, let me know. Even that video that I showed you, David, about the couple, that was the LEAPS video we'd like to use.
Great. Yeah, that's great. Lisa, your hand is up, and we are at 5:28. I think we're getting toward the end of our day, but really good. This conversation is how I wanted things to go, so I really appreciate it. Lisa.
San Andreas and maybe other regional centers, vendors with ifineedhelp.org, and they have little QR codes. My daughter has a bunch everywhere. So if she's lost or anything, anyone can check that QR code, and it gives my name, phone number, her disability, and anything that can help while talking with her. So that's also another resource.
I really encourage that. It's like the medic alert badge that we used to have, still have back in the day, and then currently have, but it's a QR code, and you can have your medical one-page profile pop up on the website that you create under If I Need Help. San Andreas, it's a vendor service, so they will pay for it. I think tri-counties might as well. The other thing about that is that it's a family opt-in, and the records are held by the family. It's not held by a law enforcement entity. So if you're concerned about civil rights and that sort of thing, that's a good bypass. Is that ifineedhelp.org worth looking at?
And they do it once a year, so you can get more stuff every year. Or sometimes I'll get an email, hey, one of these like stickers is free, or one of these things are free, and I'll just hop on there and grab it. So like I said, she has lanyards and stickers and stuff for her shoes. So if that's a possibility for people. I love it.
Okay, good. Aaron, absolutely fantastic. I really appreciate you being here.
Yeah, no problem.
Everything Aaron said is applicable in counties all over the state. If you need more information from the county you're in, feel free to contact state council. We have a number of staff that actually are part of these CIT trainings that do the IDD training that Dr. Graff does. And so feel free to contact me if you're in another county. And Aaron, let's keep in touch and figure out how to keep training our community, right?
One last thing, if you're in Ventura County and when you call 911, it's because someone with an IDD diagnosis needs help. Ask the dispatcher to send a CIT trained officer.
Oh, perfect.
You can
Great.
make that request,
great,
and if they're available, they will.
Yeah. Next week, Tuesday, we're going to have Dr. Graff present, and he's going to talk more about the services that are for the people with regional center who have cases open at regional center.